Okay. And Akash, if you could just have the Facebook page open just in case people have questions or comments.
Yeah.
And then let me pull up the agenda for us. Okay. Yep, I see your screen. Looks good. Okay, so just to have the rundown, Akash, you'll present the biotech provision, and then Chloe will talk about why this is like the pros of the biotech provision, and then you'll argue the neg, and then we'll have a kind of like an open debate, and I'll chime in too, and then the second part here is Akash. Then you would talk about what is regulatory capture, and then argue why it's regulatory capture, and then and then Chloe argue against it, and then we just have a debate, and maybe some people will join us. Who knows, right? Okay, sound good to everyone?
Mhm.
Okay, and Chloe, you got the Facebook Live going?
The Twitter thing.
Oh, sorry, I got the Facebook Live.
No, you're good. I just downloaded the app. I
Okay.
still don't see what you're talking about with the spaces, but
It's the button. Let me open my Twitter, see if I can do this.
I don't know. Maybe it's like you can't do it on the computer. I'm not sure.
You know, oh, here on the app here on the menu, the spaces in the top bottom. If you open up the menu, it says spaces. I think you can do it there.
Not seeing anything that says spaces
Oh, on the app.
on my computer.
Oh, did you? I thought you were downloading the app.
I downloaded the app onto my laptop.
Oh, you don't see the app on your laptop.
No.
Okay. Okay, I'm not logged into our account here, so I'm trying to think of how do I do this. Can you download to your phone and just do it from the phone?
My phone is like on 5%.
Oh, okay. Let me see if I could do this. Okay, I guess I could do it here. Let me try to do it. I'm not logged into our account though, so it's only my personal. But you could always, can you? I guess you could also retweet. You could also retweet my the spaces I start from my account.
I can do that.
Okay, let me try to do this. I haven't done this very often, so I'm I'm not a pro. So biotech provisions. Is that the right way of called biotech provisions?
Yeah.
Biotech provisions in the inflation. You're following me, right, on Twitter?
I should be. Yeah.
Okay.
Yeah.
Okay, so you should see my space come, and you could try joining it. Biotech provisions in the Inflation Reduction Act. Okay. Okay, we'll see if this works. Okay.
Okay.
Do you guys hear the background music? Okay.
No.
Are you able to join my spaces?
I think so. I see listen live.
Okay, why don't you try
I'll
that?
retweet it.
Mic is off. Okay, here. Just to see if it works.
You want me to join right now?
Yeah, go ahead.
Okay.
You're my soul.
It'd be a little okay.
Okay, and you could tweet it out.
Yeah, I can hear it.
Okay, you can retweet it now.
I just did. Yeah.
Okay, perfect. Okay, let's get rolling. Okay, Akash, do you want to kick it off? And can you hear me from the spaces as well?
I don't think you were talking when I joined. I can rejoin.
Oh, yeah, rejoin.
Okay. I rejoined.
Okay, Akash, do you want to kick it off? And okay, good. Okay, good. Okay.
Oh, it's the echo. Okay.
Okay, yeah, you may have to kill the mic or something. But,
Yeah.
Okay, Akash, why don't you go ahead and start it?
Cool. So we're going to talk about the biotech provisions of the Inflation Reduction Act of 2022, which was a law that was introduced by John Yamurth from Kentucky in September of 2021. And then it was just signed into law by President Biden almost a year ago in August of 2022. And it focuses on climate, energy, healthcare costs, and some tax changes. In this debate, in this presentation, we're going to be focusing more on the healthcare cost aspect and the biotech provisions of it. And in total, it authorizes above $740 billion in new spending over the next 10 years. So yeah, let's get into the first biotech provision that I'm going to talk about, which is price negotiation for Medicare drugs. So before this law was actually passed, Medicare Part D, which covers retail prescription drugs, has this non-interference clause, which basically disallows the federal government to interfere with the negotiations between a drug manufacturer and pharmacies and coverage plans like Medicare. And this has been a huge focal point for Democrats over the past, I think, decade. And they've always been looking to get rid of this so that the federal government can go in and reduce costs. And then Part B, which are drugs administered by physicians. Currently, the HHS secretary doesn't negotiate prices for these drugs, and Medicare reimburses providers based on this formula of the average sales price. And both parts drug spending is concentrated among a relatively small share of covered drugs, and they mostly don't have generic or biosimilar competitors. And as I mentioned, Part D limits the ability of the federal government to leverage lower prices for expensive drugs without any competition. So what does the IRA actually do about this? First, it adds this exception to the non-interference clause of Medicare Part D, which allows the HHS secretary to negotiate with drug companies for a small number of drugs that are covered under Part D and Part B. So in Part D, this law will take place in 2026, and for Part B, it'll start in 2028. But then there's certain categories of drugs that are actually excluded from these negotiations. First, if they have a generic or biosimilar available, they don't have to do these price negotiations. Second, if they're less than 9 years for small molecules or 13 years for biologics or large molecules from the FDA approval date, they're also excluded from negotiations. Third, if the Medicare spending of this drug is less than $200 million in 2021, or if orphan designation as an only FDA approved indication, or if they're a plasma derived product. And then what the law actually does is it creates this maximum fair price that drug retailers can sell to Medicare. And for Part D drugs, it's a weighted negotiation price. For Part B drugs, it's the average sales price, or it could also be the percentage of drugs that are the average of the manufacturer price. And this is 75% for small molecule drugs between 9 to 12 years after the FDA approval, 65% from 12 to 16, and 40% for 16 or more years.
So Akash, quick question.
Yeah.
So percentage of drugs average manufacturer price. So that's the cost to make the drug. Is that how it works?
Yeah. Yeah.
So, but how can that be? So they have to do it at a loss? I don't understand. So how does that work? So you're saying, so if the cost is $100 to make the drug, they can only get $75?
I need to look into that. I'm not sure exactly, but I believe it is.
It is. Chloe, do you know?
Yeah.
No, not off the top of my head.
Here I can look at this.
That doesn't sound right, but it could be.
It says a percentage of a drug's average non-federal average manufacturing price.
But that doesn't make sense. How can you say that you have to, but who would want to do that then? Who'd ever?
Yeah.
It doesn't seem to make sense.
Not sure exactly. I can do a little more like quick research after this presentation.
Okay.
So, yeah.
Okay. Maybe it's the total manufacturing and R&D costs, perhaps, right? Maybe that's what they're talking about, right?
Oh,
I don't know if they're talking about like the manufacturing, because that seems crazy, right?
yeah, that would mean they're always at a loss. Yeah.
They're almost at a loss, right? Okay. Definitely something that we need to know more about, but that's interesting. Okay, keep going.
So the IRA actually also enables consequences for people that refuse. So first, there'll be a 65% excise tax that will be administered for refusers and pharmaceutical companies who don't want to agree to this maximum fair price, and it increases by 10% for every quarter. There's also some other penalties that I don't know as well. but some of the funding, it's 3 billion for fiscal year 22 for negotiation provisions over
Wait,
the.
hold on. So 65% excess tax, what does that mean? So let's say I sell the drug for $100.
They will take 65% of it.
They were like, so if someone pays me $100, they'll take $65 of that 100.
I think so, yeah.
Okay. Wow. Okay. And then it increases 10% every quarter, right?
Yeah.
Is there
And
a ceiling?
only if that's only if they refuse to agree to.
Okay.
Yeah.
Well, I don't think they're going to refuse with that kind of penalty, right?
Yeah.
Are you sure that's the way it works?
Yeah, I believe so.
Okay. And when they say, on the last time it says manufactured cost, is that self-reported cost, or is that like true? How do they know what the manufactured cost truly is?
I believe it's I'm not sure exactly. I think it's probably self-reported, or they have outside
Hmm.
opinions.
But I think that's hard to figure out. Okay.
Yeah, so the effective date for when this will actually be administered and enforced is for Part D drugs, it'll be 2026, and for Part B drugs, it'll be 2028.
Okay.
And the CBO estimates that there'll be $98.5 billion in Medicare savings over the next 10 years. But they also estimate the innovation reduces by 1%, which is 5 fewer drugs in the next decade.
So that means, like, I mean, 1% less new drugs, essentially.
Yeah, 1% less in drugs. Yeah.
Okay. 5 fewer drugs. Okay. So there's 500 drugs every year, basically. It's 1%, or 500 drugs each decade. And so that means 5 less drugs per decade.
Yeah.
Okay. So if I was manufacturing something and I had to pay, how much was the penalty again? Can you go back a couple of slides? How much was that penalty? That was
65%.
one more back. Oh, sorry, one forward. So 75%. Oh, but it's after 9 to 12 years after approval. I see. Okay, so it's not immediately. So there's a buffer window.
Yeah.
But still, to make it lower your cost is still crazy, I think.
Yeah.
Okay, sorry, I want you to keep going. I'm just trying to understand.
So this is just the timeline for how this negotiation will actually work. So the drugs selected for negotiation will be published later this year. And and this is for Part D, I'll just go off this, and then the negotiation process will actually begin also later this year in October, and the process will end in August of 2024. And then your maximum fair price would be established by September of 2024. And then 2 years later, or 1.5 years later, the negotiated prices would take effect. And then for Part B, it's just a little bit after, but it's the same timeline. So the second thing is there's rebates for price increases if the drug price increases above the inflation rate, or if the price increase rate is above the inflation rate. So Medicaid actually already has this, and it forces pharmaceutical companies to pay a certain rebate. I don't know about how much, but if their rate increase exceeds inflation. And Medicare actually had no authority to limit these annual price increase for Part B or D drugs. And half of drugs covered by Medicare had increases above inflation rates in 2019 to 2020. And the IRA requires manufacturers to pay a rebate if the price exceeds inflation for single source drugs and large molecules covered under Part B, and also most drugs covered under Part D. So how these price changes are evaluated is for Part B, it's the average sales price, and for Part D, it's the average manufacturer price. And the penalty for not paying is 125% of the original rebate amount. So if you don't pay these rebates, they'll charge you 125% of that, and you'll be forced to pay that. And the effect of this, it actually, because pharmaceutical companies don't want to lose profit, what they'll do is they'll increase launch prices for new drugs on the market, rather than have their rate stay kind of constant at a high. Yeah.
So they just don't want to be increasing the prices, right?
Yeah, yeah.
Yeah, I see. Okay, makes sense.
And some other stuff that are included in the IRA for these biotech provisions. First, it caps out-of-pocket spending for Medicare beneficiaries at $2,000. And then it limits the cost sharing for insulin at $35. And it also improves access to vaccines covered by Medicare. And it further delays this Trump administration drug rebate rule, which basically eliminated rebates negotiated between drug manufacturers and pharmacy benefit managers or health plan sponsors in Medicare Part D. So basically, this previous slide is completely the opposite of this Trump administration's rule. And they've just been delaying this rule through numerous laws, I think. I'm not sure exactly which ones, but including this, there's been other laws that, yeah. So
Wait, what? Wait, so further delays. Why would you want to? Like, I guess if this seems counter to the other one, why would you want to not allow? I mean, if you're trying to get lower cost to people, why would you delay?
This is the Trump administration's one, which basically means that drug manufacturers don't have to pay rebates.
I see. So instead of having to pay the other one, instead of having to pay the Trump one, they're doing this other rebate.
Yeah.
There's a different rebate program.
Yeah.
I see.
Trump's one would basically eliminate rebates for drug manufacturers. And then what Biden's
yeah. I see. Oh, I see. So that was going to eliminate it. This other one's now going to implement it.
Yeah.
I see. So it's like 180 degrees.
Yeah.
Okay, I get it. Okay. And then so out-of-pocket spending, that means, is that for the insurers or is that for the medical providers?
For the actual Medicare beneficiaries. So
I see. Okay.
People covered by Medicare.
Oh, I see. Okay. I see. Okay. Makes sense.
Yeah. That's all for me.
Okay. Chloe. So why don't you argue the pros? What are the pros of this?
Okay. I think it's pretty clear that the provisions were needed, specifically the ones that tackle the rising drug costs and inflations. Analysis shows that half of all drugs covered by Medicare had list price increases that exceeded the rate of inflation in between 2019 and 2020. And then a separate analysis done by the HHS Office of Inspector General showed that the average sales price increases exceeding inflation for 50 of 64 studied Part B drugs in 2015. So I think that demonstrates that the issue of drug prices rising faster than the rate of inflation is a really big problem that needed to be addressed. Additionally, these provisions are going to save us a lot of money. The CBO estimates a net federal deficit reduction of over $63.2 billion over the next 10 years from drug inflation rebate provisions alone in the IRA. And so this includes a net savings of $56.3 billion and then $71.8 billion in savings to Medicare and $0.3 billion savings in other federal programs. So I think that one of the overarching goals of the IRA was to reduce the federal deficit. So this helps us get closer to that. And then the act penalizing drug makers for increasing drug prices faster than inflation is not only going to save money for the government, it's also going to help drugs remain more affordable for patients. So it goes in the public's best interest as well. Additionally, medicine will become generally more affordable by allowing Medicare to negotiate drug prices and cap insulin prices. The bill will make certain prescription medications more affordable for millions of Americans, including biologics and drugs developed using biotech. And these drug pricing provisions will also reduce the federal deficit by $237 billion over 10 years. So I think it's really generally the pros are that it's saving money for both the government and for individual Americans. And I'll leave it at that.
Okay, great. Thank you, Chloe. But did you have any visual aids that you wanted to show? Or okay, don't worry about it. Okay, Akash, do you want to argue the neg?
Yeah, sure. So I think that while the aim of these provisions is to reduce the cost of prescription drugs in healthcare, it has the unintended consequence of reducing innovation in the pharmaceutical industry. Right. So I think firstly, the Act's provisions to control drug prices, like the introduction of price negotiation and inflation penalties, have been met with resistance from pharmaceutical companies, and for good reason, because they argue that these measures could potentially reduce the revenue that is often reinvested into R&D for new drugs. For instance, Amgen's CEO, Robert Bradway, argued that the Act's provisions could lead to a decrease in the number of new drugs being developed, as a reduced profit would limit the resources available for R&D. Also, as I showed in the presentation, we'll have 5 fewer drugs made in the next decade because of this law. And I think this is also particularly true for companies focused on small molecule drugs as compared to biologics. Also, small molecule businesses are at a disadvantage because of this law. They can only be developed for 9 years before prices are negotiated, compared to the 13 years that biologics get. And as a result, we see a lot of companies move away from the small molecule business because it's becoming non-profitable now. I think PHRMA conducted a survey that found that 63% of member companies expect to shift away from small molecule drug development. And I think the second thing is only the most expensive drugs to Medicare will cross the negotiation hurdle. That sweeps up oncology drugs that have a high cost individually, but it also means that drugs to treat stroke and diabetes that almost every Medicare patient may need or want can go over that line. So the incentive to work in those areas is only going to get further reduced. And I think the third thing is that the Act's provisions could also lead to increased legal battles over drug pricing, as pharmaceutical companies will look for loopholes to maintain their profit margins, right? As I mentioned, they could increase launch dates, or they could do all sorts of other things. And what this would do is it would divert resources away from innovation and towards litigation instead, which would further reduce the potential for new drug development. And then the last thing is, I think it would also potentially discourage market entry for new pharmaceutical companies. The increased regulation and potential for lower profits could make the pharmaceutical industry less attractive than it has been for new entrants, leading to less competition and consequently less innovation. And I'd also like to bring up this theory of utilitarianism, where I'd ask that we prioritize everyone rather than 18.5% of the US population, because that 18.5% is on Medicare. And I think it's better that we prioritize 5 life-saving drugs for everyone that could save 100% of the population, rather than focus on just an 18.5%. Yeah, that's all for me.
Okay, great. Thank you, Akash. Okay. Chloe or Akash, do you guys want to respond to each other's arguments?
Chloe, do you want to go first, or?
Yeah, sure. I mean, I think that it's pretty nuanced. Some of what Akash said, I put in the document, and I think that a lot of what he said is valid. I know that's not what you're supposed to say in a debate, but what I will say is that I think that lowering the cost of individual medicine is more important than the profit of biotech companies. And I think, of course, biotech companies are going to be like, well, we are not going to make these drugs anymore, and we're not going to do this, and we're not going to do that. Of course they don't like this. It's not meant to benefit them. I will say that I don't think that the harm that it's going to cause these companies is going to be as massive as they're making it out to be. Like the statistic you said, it's going to be like less than 1% drugs being introduced every single year, which I think is a pretty small number. And I ultimately think that the pros outweigh the cons on this one. So although there might be some impact with innovation and profit, I think that there are going to be millions of Americans who have access to more affordable medication. And I personally just think that that's more important.
I had one question. So you said that there would be I think a 63.2 billion decrease in the federal deficit. It would help the federal government save costs, right? Mm-hmm. So do you know how much they're spent on the biotech provisions in the IRA? Like how much money is allocated to spend in this?
I don't have that number off the top of my head. I would have to look at that another time.
Okay, because I was just wondering if that number is higher than the amount of money that the federal government would actually save, but I'm not sure either. So yeah.
Wait, so gosh, I didn't understand the question. What is the question?
So I was wondering how much money the government would spend on these biotech provisions and enforcing them, and
Oh, the enforcement cost.
yeah.
I don't know.
I would assume that the statistic like from the CBO about how much reduction of deficit there would be most likely incorporates I'm not saying that I know this for sure, but I would assume it incorporates the amount of money that's being spent on the IRA. I don't think it would make sense if they just excluded that number, because then I don't think that would really be an accurate estimate.
I see. Okay. Yeah, so I'd like to say, like, I think Chloe, yeah, you're right on a lot of points. Like, lowering drug prices is a huge problem. But I think these lower drug prices are only applicable to less than 20% of the US population. And I'd say that those 5 fewer drugs that could potentially solve some of the world's most pressing problems, I would say we should prioritize those over a minimal decrease in cost for certain drugs and I would also argue that I think a lot of the focus now would be that drug companies and pharmaceutical companies are actually going to try and find loopholes, like I mentioned, to maintain their profit margins. I know the IRA wasn't awfully specific in how how maximum fair prices would be guaranteed, and I think drug pharmaceutical companies are going to take advantage of that to mean that there's barely any lower drug prices, but they still have to abide by the regulations, and that ultimately leads to them losing profit. And yeah, that's all for me.
Chloe or Kash, you guys have any other thoughts?
I mean, I think we could go back and forth for a while,
Yeah.
but I think in the interest of time, we can move forward with the regulatory capture.
Okay, so one thing I was listening to a podcast this weekend. Here, let me share my screen. I'll show you guys something. I thought it was kind of interesting. So I was listening to this podcast, and they were interviewing this guy named Mark Cuban. I'm not sure if you guys heard of him, but he did a bunch of startups and companies, and he's an investor and whatnot. Anyways, he started this company called Cost Plus Drug Company. And I don't know a lot about the drug industry, which is why I asked you guys to debate it, because I'm trying to learn, I'm trying to get smarter about this. And what I didn't realize was how crazy inefficient the drug distribution was in our country. So unlike, you buy something on Amazon, right, and it's a pretty good price, or Costco or whatever, drug prices are marked up like crazy, like, and not just by a little bit. So if you go to his website, he shows the example, right? So like the retail price for this drug, I mean, I don't even know what this drug is for, but is like $2,500. Like, but they're selling it for $11.40, right? So you see these crazy, and it's not just this one, but like drug after drug, right? There's like such a delta between, the retail price and then the price that they're selling it for, and he's actually making money doing this. And I guess the thing that struck me was there's the cost of the drug itself, manufacturing the drug, and there's also the cost of distribution. But at least from this little example on this website here, I hadn't realized how much the distribution was of the total cost, right? I mean, so you don't actually have to change the price of the drug that much, right? Because what his business model was is basically just 15% more than the cost that it costs his company to buy it, right? So whatever his cost is, he marks it 15%. So it's basically the cost of this for him, right, to buy this, or his company to buy it, is basically 50% lower, right? This is a very simple business. The cost, his whole company's called Cost Plus Drug Company. So I wonder in the IRA, because it looks like there's a lot of money that's being taken up by the distributors of these drugs, not just the not just the manufacturer, right? It's like, I mean, the distribution cost of these drugs is just crazy high, right? Do you guys know, did the IRA cover any of this, or was it just purely the manufacturer part?
I'm not completely sure.
Okay. Because if it didn't cover the distribution, I think that's actually maybe where some of the opportunity was, because I just think about, like, if there's ever, is there any other industry where we mandate the price to be lower than the manufacturing cost? Is there anything like car, a shoe, a food? I mean, is there anything where is there any example of where the government has said you have to sell it at a cost below your manufacturing cost? Is there anything like that?
No, I don't think that really makes sense, because the company would almost always be at a loss. But
Yeah, I'm just trying to think. I think I'm definitely wondering if that slide's correct, because I can't
yeah,
believe that's true, right? Because how, I mean, I could understand saying you can't make more than a certain amount of profit. Okay, I get that, right? But to say you have to sell it below your cost, I'm trying to understand how that works. Because who would sell it then, right? If it's below your cost, you're losing money, right? You're literally
Yeah.
losing money in every sell, right? But anyways, maybe that's something that we could research and figure out what it is. But I think it's got to be 75% of the profit or something like that. That makes more sense than the
Yeah.
cost. But the second thing I wonder is, like, just given, like, I just wonder if most of the drug cost actually is not the manufacturing of it, but it's the distribution of it, right? I mean, if I look at his website, it implies it is, but I don't know if that. I'm not an expert in this stuff, so I don't really know. But do you guys have any idea of like what the breakdown is between distribution cost and manufacturing cost? Because this one here is like manufacturing cost is like $10, and the distribution cost is like 2,500, right? So it's like, oh my God. Like, so I mean, even if we got this down to 75% of $10, so it's like we save $2.50 on it. Most of the cost is on the distribution side.
Oh, yeah. Oh, also, I did a quick Google search about this average manufacturer price, and I think I was actually wrong. They're not actually taking it out of how much it costs to make the drug. It's actually the average price paid by wholesalers for drugs distributed to non-federal purchasers.
Okay, that makes more
It
sense,
makes
right?
more sense, yeah.
That makes more sense. Because if it was a manufacturing cost, that's like,
Yeah.
that's unheard of. Okay, so that's the correction there. Okay, makes sense. Okay, so maybe let's move on to the next one. Okay, Akash, do you want to explain what is regulatory capture?
So regulatory capture is basically this economic theory where a regulatory agency serves industry interests over public interests. And then it occurs basically when an industry influences the agency that's regulating it. And some of these methods include lobbying, funding, and revolving door employment. Some of the consequences of regulatory capture are weaker regulation enforcement and growing monopolies and less competition and biased decisions. And it leads to obviously less competition, higher prices because of this monopoly that forms, which allows the drug manufacturer in our case to create higher prices and lower quality because they're the only people there, so they don't have to focus as much on quality. And some of these examples are during the Industrial Revolution, the transportation industry, where regulators actually openly advocated for the industries they oversaw, including railroads, and large railroad companies themselves advocated for regulation. It's based and also in finance, where regulators consist of industry insiders and have overlapping interests with the industry, and often support the interests of the actual industry rather than their job, which is to serve the public. And then a more modern example that's happening right now is actually with AI regulation. And I know Councilmember Tanaka discussed this, and how OpenAI is the CEO of OpenAI is actually supporting regulation for AI because he knows that even though OpenAI will take a small hit, all the smaller companies that will try to start will actually be at a huge disadvantage, which once again creates this monopoly for OpenAI. So yeah, that's
okay. Do you want to argue why this provision is regulatory capture?
yeah. So Yeah, so I think that the IRA was this huge bill that a lot of big pharmaceutical companies spent a ton of money on, right? I think AbbVie, Eli Lilly, Co, Roche, Pfizer, Johnson and Johnson, and so much more have spent thousands of dollars lobbying on this IRA. And what they do when they lobby is, even though they protest some of the laws, they also cozy up to legislators and make it harder for competition to exist. And we see this in some of the rules that I'll go into later. And the bill was actually the most targeted in federal lobbying efforts across all industries last year. And sure, the IRA does hurt the majority of pharmaceutical companies. It specifically hurts the smaller companies more than the bigger companies, and it reduces competition for these pharmaceutical giants. So, as I mentioned before, small molecule businesses are at a huge disadvantage here, as they have only 9 years to develop before price negotiation starts. On the other hand, large molecules get 13 years. And this is regulatory capture in two ways, because first, it reduces the competition in the small molecule industry, as only the biggest companies with the most money and resources for research and development will be able to stay profitable, right? In fact, we already see most corporations shifting away from the small molecule drug development. I've said, 63% of PHRMA market sponsors have moved away from small drug development and are focusing on biologics. But what it also does is it gives large molecule businesses a huge advantage. AbbVie, Amgen, Johnson & Johnson, Pfizer, all industry leaders and have lobbied extensively for this bill, have significant presence in biologics, and this law gives them a huge advantage, because even though they lose a little of their small molecule drug profits, they make up for that through this extended period of time that biologics receive. And biologics are actually more of a monopoly, this is an area that's dominated by the top 10 pharmaceutical firms, which control 90% of the biologics market. So basically these 10 pharmaceutical firms are a huge advantage here. And yeah, I think that's the main reason that I think that this is regulatory capture.
Okay. Chloe, do you want to argue the next?
Sure. I think that the main reason that the provisions do not constitute regulatory capture is that the provisions are specifically in the public's best interest. They're designed to serve the public interest. They aim to lower drug prices, cap out-of-pocket spending for Medicare Part D enrollees, and ensure that drug price increases do not outpace inflation. So these measures are specifically intended to benefit patients, particularly those with high drug costs, rather than serving the interests of the pharmaceutical industry. Additionally, this act directly allows the government to negotiate drug prices, and I think it's a pretty clear indication of the government taking an active role in regulating the industry, rather than the government being influenced and controlled by the industry. And I think that the negotiation process is designed to ensure fair pricing, which serves public interest rather than the interests of the pharmaceutical industry. I think that the enforcement mechanisms for non-compliance, like the penalties, demonstrate a really strong commitment from the government to enforce the regulations in the interest of the public. I could continue, but I think that generally, all of the provisions are designed to be in the public's best interest, not the pharmaceutical industry. And it's also my understanding that a lot of the top pharmaceutical biotech companies lobbied against the IRA and didn't want it to happen. I read a lot of statements from different pharmaceutical industries detailing how the IRA was going to harm them. So I don't think that this benefits them. And even if it puts a lot of pharmaceutical companies in a better position than smaller ones, it's still primarily in the best interest of the public. And there isn't a lot about this bill that screams, we are helping the biotech industry. So those are my arguments for that.
Akash, do you want to?
Yeah, I think I would argue that even if it's meant to serve the public, it either directly or indirectly helps all these pharmaceutical giants, right? Because we don't know what exactly they were lobbying for. Like, some companies will have statements, but a lot of them, the lobbying goes through back doors, right? And we don't know if they're lobbying for certain laws and regulations, like the 9 to 12 year difference, or if they're lobbying against the entire bill as a whole. And I would argue that, yes, it may serve the public, but I think regulatory capture, even though it serves the public's interest, what it does is it helps create this monopoly for all these pharmaceutical giants. And I think that that's because they were such huge lobbyists. I think that that's kind of the purpose of this bill. I would argue that it makes pharmaceutical giants even more powerful, and it prevents competition from arising.
So I heard two things that were counter to each other, and so I'm trying to say which one is true. So one side is that some of the large drug companies, I think Kashi said Johnson and Johnson, if I'm not mistaken,
Yeah.
lobbied for this. And Chloe, I think I heard something also from you that they actually lobbied against it. So which do you guys know which one is it? Did they lobby for it or did they lobby
I
against it?
didn't say anything specifically about Johnson and Johnson lobbying against it. I just said that I've seen a lot of pharmaceutical
see.
companies lobby against it. I don't know about Johnson and Johnson
okay.
specifically.
Okay, but did Johnson and Johnson actually lobby against it or lobby for the bill?
I believe Johnson Johnson did, and
I see. And how do we know they actually log it somewhere?
yeah, I was on like an open secrets website that I can share, but it basically detailed all the logging that they did.
Actually, can you share that? I didn't see that.
Yeah.
So that's interesting. So I mean, I would think, given the way what I understand about the bill, and I'm not as expert as you guys right now on this. Oh, do you want to show your screen, Akash? You could just bring it up so that people could see it.
Sure. Yeah.
I would think all biotech firms should lobby against this, right? I can't imagine anyone would lobby for it. Like, what?
Yeah, I think most of the big companies lobbied against it, but I think what I was kind of arguing is that what it does is they could lobby against it publicly, but like through back doors, they could create these special loopholes for themselves and stuff like that. But yeah.
Okay, but Johnson and Johnson actually lobbied publicly for it.
I think most I was just going through their lobbying record. I can show you here.
Sure.
Yeah, could you see this?
Yeah.
I'll
Yes.
just say though, I was trying to use open secrets when I was also looking through this, and some of what was in there was contradictory to information that I was finding on the FEC. So I stopped using it. I don't know if it's reliable or not. I'm just gonna put it out there that I was having trouble with that site and I don't know where they get their information from.
Yeah, I'm not sure. I didn't do much research into
Yeah,
that.
I don't know either. But okay, so what exactly? Okay, so where does it say that Johnson Johnson's pushing for this or push for that?
So this is all the issue reports that Johnson & Johnson has made
Okay.
for this bill, and I
see.
think it's somewhere here.
It looks like they were very active on this bill, right?
Yeah, no, they're not even the most active one. I think like Pfizer had a lot more, and
what did Pfizer do? Were they pushing for it or against it?
I believe they were pushing against it, but I don't think they made any public statement. It's like Roche, Amgen, Pfizer's, Eli Lilly.
But just because they published, I mean, how do we know that the things that Johnson put, like the 22 things they did on it, how do we know that it wasn't against the bill? How do we know it's for the bill?
I think I think the majority of them were against. Majority of because I think a lot of companies had issues with this, and they published like this is an amendment that they proposed. And I think most pharmaceutical companies lobbied against it, but I also believe that there were specific loopholes created to benefit certain pharmaceutical companies more than others.
I see. And so you're saying this is one of them?
I think yeah, as I mentioned, the small molecule versus large molecule year difference. And
I see. So you're saying that the companies that had a large molecule business basically are benefiting because it makes the people who have small molecule businesses make it a worse business for them. Is that what you're saying?
Yeah.
Okay, and this in the case with Johnson Johnson, you're saying that they have a a uh a bigger large molecule business. Is that
I believe so, but I think Johnson and Johnson, I was just reading through like some of these lobbying efforts and I just found one that supported it, but most of them are against it. So
okay? Where's the one that supported it?
I think it's down. I think it might have been this one, but I'm not sure exactly. I think it's this one, yeah. But
Wait, what does it say that on this?
it was right here. I kind of assume this, but I'm not sure exactly. I think most of them there have issues with.
No, but how do you know that the one you highlight in pink is for it or against it?
I just read this and I thought it was kind of assumed, but I don't think it. Now that I look back at it, it doesn't really say anything.
Value of prescription going to. But does it on the form? Does it say it's pro against?
$50,000.
It's kind of good that they have to actually log all the lobbying that people do. That's actually good practice, right? I think that's transparency. So you can, but you don't. It doesn't necessarily say whether it's for or
Yeah,
against
it doesn't say for or against.
Okay. Yeah, I mean, on the city council level, we have to publicly disclose, right? That's one of the reasons why I live stream stuff is because of that. We have to disclose, but we don't actually have a form like this to file. So that's interesting. Okay, cool. Okay. So do either one of you have any other thoughts on each other's arguments?
No, not really. I think I'm kind of for regulatory capture. I think I'm more, it isn't regulatory capture just because I saw, like Chloe mentioned, the widespread, well, forgetting the word for it, but many pharmaceutical companies did not support this act. I know Amgen, Genentech, and I think Roche all vocally.
Yeah. Yeah. Okay.
Yeah,
No, that.
I mean, I think Akash's argument, like that he was asked to make, is pretty difficult because earlier he's like, "Oh, this is going to really harm the biotech industry,"
Yeah.
and then to say that it is regulatory capture, like those
Yeah.
two things are inherently contradictory. So I think that that's pretty difficult to argue. So
Yeah. Yeah. Well, I think usually what happens, like I don't know the pharmaceutical industry that well, but I do know like to follow the AI industry quite closely. So typically what happens is the regulation does hurt everyone in the industry. That's typically what happens, but it just hurts some people way more than others. So like in the case with OpenAI, it will slow them down a little bit, but they have lots of money and lots of people, so it's not a big deal. But some guy in his garage, trying to make the next great startup, he doesn't have the money to hire a bunch of lawyers to do that kind of stuff. So it usually quashes his ability, but not necessarily the big guys. But in this case, I don't know. I think I'm kind of more with you guys because it sounds like we haven't seen any evidence of people lobbying for it. Like in OpenAI's case, it's kind of blatant because the guy's going around the country saying, "Oh, we should regulate AI," right? So that's kind of he's pushing for it, right? But in this case, it doesn't sound like you guys found anything public. People who are saying
every public statement that I saw was from a pharmaceutical company explaining how this was going to be damaging to them.
So it's very different than in the case with AI, where there's literally people out there, like the heads of these AI, these major AI companies saying, "Oh, please regulate.
Yeah, no,
So that's very different
not
than
like
in this
that.
case. When yeah, yes, not like that. So it's probably not regulatory capture. Okay. So good. Well, this has been. I think both of you guys did a really good job. You know, I'm a lot smarter about what's happening here. Um, I think I agree. I think I agree with both you guys on the regulatory capture thing. In terms of the biotech, in terms of being a net positive, net negative, um, you know, I hadn't listened to Mark Cuban's talk about his drug company, I um you know, because my mom's a diabetic, and you know, insulin, you know, is kind of a major cost. Um, so I think we want, you know, I think health and safety of our people is really important. Um, but what I hadn't realized was how much money is taken by the distributors. I hadn't realized that. I mean, it was just like not, it's not just like 10%, 50% margin. We're talking about like 20x, you know, 200x margin, right? It's like, oh my God, like a drug goes from $10 to $2,000. That's 200 times the wholesale cost, right? I mean, that just seems outrageous. So I just wonder if there should have been some focus on the distribution cost as well. But so, and neither one of you guys know whether
There might
there's
have been. Like
there
that
might have
wasn't
been.
something that I specifically focused on, but I don't think we should say that it wasn't in there yet. I can double check,
Honestly.
but I feel like
Okay.
there might have been something addressing that.
Okay. I think that would be interesting to actually look at that, because I think that's um I mean, so what Mark Cuban talked about how he started this company, and he was saying that when he looked at the wholesale drug prices, and he looked at, you know, Mark Cuban is like the Uber businessman, right? He's like, you know, he whenever he sees an opportunity, he goes for it. And he was talking about how just of a amazing opportunity this was because the wholesale drug prices are relatively low, and then but the consumer gets charged something relatively high, and not just by a little bit. It's not like, um, you know, when we buy like a dozen eggs, right? Um, you know, they're marked up maybe 50%, maybe 200%, right? So maybe 2x the price, maybe, right, from the wholesale price. But I don't think there's anything consumer except for maybe drugs that gets marked up 200x. I mean, that is just that is like over the top. I mean, I yeah, that seems crazy to me. Um, but Akash, I think you made some good arguments about innovation. You know, if those five drugs are one of those five drugs are ones that, you know, my kids needs, I would really be like, I kind of want that drug to be created, right? So I kind of get the innovation part. And then I think what you found out more about how this is not on the manufactured cost, it's actually on you said the wholesale price, right? Okay, that makes a lot more sense, right? Because what happens is the price of drugs over time, it drops over time, right? The manufacturing costs. So they have more profit margin, right? So that makes more sense. So, and Chloe, I agree with you in terms of, you know, of course, reducing the federal deficit is also a good thing, right? And also trying to get more people help, that's also a good thing too. So I guess I understand the innovation argument too. So I think both sides are well argued. I think I just wonder if the elephant in the room really is the distribution cost, though. That's the thing I wonder. I just don't. Do you guys know I don't know if whether Mark Cuban just puts the most egregious drugs on there, or whether that's typical. Do you guys have any idea of like what percentage the distribution cost makes of the total drug prices?
No idea.
No idea. Okay.
Do you know
I
if
would assume if it's a big cost, it would have been a big thing in the IRA.
I would think so, right? I
So
would think so.
I don't know.
Yeah.
It
So
wouldn't
we're
make sense for him to put egregious costs on there to draw attention. And I know
yeah.
he's quite the character, so I will say that, but I don't
I,
know.
I don't know him at all, but I just know that he's been very successful in almost every business venture he's done. But I don't know this industry very well. So Kash, you were going to say something?
yeah, do you know if his company is profitable right now or
Crazy profitable. Yeah. So he was talking about he had a part. So he was doing a interview with so one of my investors was Jason Hortz, A16Z, and so one of the general partners there was interviewing him, and Mark Cuban was talking about like this drug company that he started, right? And it's the only company with his name on there. And he talked about how he got started, and he says he got started because um he said he talked about how the industry was so opaque. The prices were very opaque. No one knows what the prices was. You have like the three body problem, all this kind of inefficiencies, and then when you looked at how much the drug prices were selling for, like the what like, you know, the three of us would pay for a drug versus how much the wholesale price was, he was floored. He was like, oh my God, like, you know, 10x, 20x, 200x, right? 100x price differences like between the wholesale and the price that the consumer pays. And he says, got to do something about this. So that's why he started this drug company. And it's basically his business model is 15% more. So he reports how much it cost him for the drug to buy the drug, and then how much he sells it for. So he talks about how this is going to save the government just a crazy amount of money because of the margin that's taken out of the system from by the distributors. So yeah, so and just the kind of the profound social effect by making a lot of these drugs a lot more accessible. He was talking about some of these cancer drugs and some of these other stuff, and I was like, wow, that's actually pretty amazing, right? But I don't know whether he's just cherry picking the numbers and cherry picking the drugs or whatnot. But it seemed like a pretty compelling argument. I mean, the prices that he offers to sell it at is lower than a lot of people's deductible. So if I were to buy a drug, it's cheaper for me to buy it from cost plus, like penicillin or whatever. It's cheaper to buy it from cost from there because it's cheaper than my deductible that I'll pay at at the local drugstore. And so it's like, wow, that is crazy, right? So I just wonder, so yeah, if you guys can help do some research on that, that would be awesome. But I think we're just about out of time here. Anything else that we should chat about? Okay. Hey, great job, both of you. Thank you.
All right, thank you.
Okay. See ya.
Thanks. Okay. Bye.
Bye.